Hi, my name is Bailey Poole, and today I will talk about ACL injuries. The question that I asked was, why are ACL tears and re-tears so common among today's athletes? Here is the APA reference for my article, and this source is reliable because it is backed by the AOSSM, which stands for American Journal of Sports Medicine. Some non-reliable sources of information. This could be hearsay with no evidence to really back it up, information with bias, as well as social media. In my case, I have heard from different people several different opinions about ACL tears in women as well as ACL tear prevention. Additionally, I know two girls from my high school who I've played sports with who have suffered from either contralateral ACL injuries or ipsilateral ACL injuries within the 2-year post-op time frame. And this really sparked my interest to look more closely and do my own research. The title of my article is pretty wordy, and before reading this article and doing my own research, I did not know what some of those words meant. For the sake of time, I'll go ahead and read the interpreted title, which is Things that we think cause non-contact ACL injuries to the opposite knee after you've had an ACL injury to the other knee, specifically in high school and college female athletes. A little bit about the background of this article. It is common for a female that injures her ACL to injure the contralateral, that's opposite, ACL after recovery, but little is known about the risk factors. The hypothesis of this study is that the characteristics of the uninjured leg at the time of the other leg injury are related to the risk of a CACL, opposite ACL tear. And the risk factors are completely separate from those at the time of the first ACL injury. The demographics of this study. In this study, 61 women who experienced a first-time non-contact ACL injury while playing high school and college sports were studied. This study took place in various parts of America as it studied separate women's progress. Methods of this study. The study measured the potential risk factor on the uninjured leg soon after the injury, but before reconstructive surgery. The women's progress was tracked until a CACL, opposite ACL injury, or an ACL graft injury occurred. So that would be same side ACL injury. So follow-up information was available for 55 of the 61 athletes, that's 90%, and 20% suffered a CACL injury. Younger age, decreased participation in sport before the first injury, decreased anterior stiffness to the contralateral knee, and increased hip anteversion were associated with higher risks of additional injuries. So in conclusion, some risk factors are changeable and some are not. The relationship between younger age and a following CACL injury is a confounding variable because it's very hard to tell if younger athletes are more susceptible to injury or if the fact that they have a longer period of time to play sports and more sports to play increases the probability of injury. The discovered risk factors from this study do not apply to women who have only had one injured ACL. As I mentioned before, there have been several people from my high school who have experienced ACL tears. 2 of them have been girls that I've played sports with. One suffered from a contralateral ACL tear and one suffered from a re-tearing of the same ACL. And so after having that happen, especially within that 2-year post-op mark, I wanted to know a little bit more about that so that I could have more informed conversations and start to learn a little bit more about what I can do as an athlete to prevent these things from happening. Thank you.